H.E.A.R.T with the H.E.A.R.T Academy, and today we are going to be practicing the Prometric skill of placing your patient on a bedpan. So we're going to assist our patient with getting on this bedpan today. With that said, same preparation and completion steps. Checking our care plan to make sure it's safe for our patient to sit on the bedpan. Sometimes you have patients that have hip fractures, range of motion issues. So we checked the care plan. The nurse said it was good. We're going to move forward with that. We're knocking and introducing ourselves. Hi, I'm H.E.A.R.T, Mrs. Buttersworth. I'm here to help you get on the bedpan. Is that okay? Yeah. So we explained what we were doing. We got the patient's permission, and we're going to go ahead and get our supplies and provide privacy. And we're going to make sure her bed is in a low, safe position. She has her call light in case you need anything while we're gathering our supplies. Now, a couple things with this. For the Prometric exam, you will be doing this on a live person. So either you're going to be the actor or the person you're partnering with is going to be the actor. But for putting a patient on the bedpan, this is a live skill with a live person. Another thing I wanted to point out was the bedpan. We have a couple people that get confused with the bedpan and which part is the front and which part is the back. With this bedpan, holding it this way, the wide portion, flat portion, flat, goes to the back of the patient. Their buttocks, back of the patient. The front part of the bedpan has a lip. You can place under the patient, grab the lip, pull it from out under the patient, and it also has a place where you can put a patient label or just use a marker and put their name, room number, bed, etc., etc. But we do have people that get confused because of nerves or whatever the case may be, and they put the bedpan in the incorrect way. So make sure you know the correct way to place the bedpan. With that being said, as per usual, I've already gathered whatever supplies I'm going to need, which is a bedpan. And back to the point when I was saying the patient that may have the hip fracture, there is a fracture pan that the patient can be placed on as well. But we're going to use this one today. So, bedpan, Chuck's pads. I always get a couple. Tissue, of course. Gloves, because we wear gloves, we change twice or at least twice. Anytime there may be stains or soils, wear your gloves. And then, of course, wipes. You can also have some additional supplies like towels or washcloths and soap. And I'll explain that in a minute, why you can have that as an option. But when you get to Prometrics, your NAE is going to have the room set up. And when they hand you your skill, make sure you read and read well to know what your patient is going to need. And it kind of explain, if you can read between the lines, what supplies you'll need as well. So with that said, we're going to get started. Again, I've washed my hands. I have my supplies. I've explained everything. Now I'm going to raise the bed up to a comfortable position for me, so I'm not having any back injuries or hurting myself. And we're going to put Miss Buttersworth on the bedpan. So I'm putting on my gloves. I'm bringing my table a little bit closer. Make sure you have your hamper. And then again, we have our door closed and we have the privacy curtain pull, but we're still going to try to minimize exposure or overexposure as much as we can. So I am pulling the covers back, and then you would bring her gown up. Another tip or a hint, just depending on your patient and their mobility and sometimes their cognition too. Can they understand what you're explaining? That's going to determine how you place the bedpan. So there's a couple ways you can place the bedpan. And I'm just going to demonstrate one way. If the patient is mobile and have a good understanding, they can bend both legs with their feet flat on the bed. And you can place the bedpan wide side to the back, wide side to the back. Place the bedpan under the patient that way. Before you even put the bedpan on the bed, make sure you have a Chuck's pad or a towel or something. You can ask this patient to lift her bottom. And I'm going to kind of roll this just to prepare it. Now, she has a catheter, so she's getting on this bedpan to have a bowel movement. All right, Mrs. Butterworth, I'm going to get you to lift your bottom, and I'm just going to kind of help support under your hip. And she's lifting her bottom. And while she's lifting her bottom, I'm helping to support, and I'm rolling the pad up under her. All right, pad under her. We can repeat the process and do the same thing and put the bedpan up under her. Giving her instruction. Okay, Ms. Butterworth, I'm going to have to help you and have you raise your hip. She's going to raise up. You take your bedpan and you can place it under her that way. And that way you still have this little lip here where you can pull if needed. That's one way to do it. Okay. I'll show you the way that I kind of like, because it minimizes strain on your back. And infection. Now, a couple things I do want to say and point out with placing a bedpan. And again, you're going to have to pay attention to the instructions that's on the sheet that the NAE gives you. So you'll know what supplies to get. Because some of the other supplies that you could have or maybe should have as a part of the instruction, based on what you read, is powder or cornstarch to place and sprinkle around the edge of the bedpan. This prevents the patient's skin from sticking to the bedpan, which could be a major problem, and they can end up with a skin tear if we don't do that, because elderly people have thin skin. But anybody's skin can stick to this. Also, the second Chuck's pad. If you don't have the powder, we're going to put another pad for a couple reasons. It's twofold. First reason, prevent the skin from sticking. Second reason, prevent urine from splashing. Okay? So that's what we're doing. So before I do this, the second way I was explaining to you guys would be to have the patient roll. So I prepared my pad. I'm going to ask the patient to help roll. And she can either cross her arms across her chest and lift her knee or not. Whatever is comfortable to the patient. But anyway, I'm going to assist her with turning by grabbing under her shoulder and under her hip. And I have her turn to her side. While she's turned to the side, I'm rolling my pad up under her, making sure she is completely covered. A little bit above the butt, a little bit under the thighs. In case there's an accident, we have more area covered to protect the linens. I'm going to roll her back and have her roll towards me in the same fashion, grabbing behind her shoulder and hip, and roll the pad out. Bam. Now she's covered under the bottom. Now, when you are placing the bedpan, rolling the patient like we did, we're going to go ahead and either sprinkle our powder first or put our Chuck's pad first. Seeing as though we're using a Chuck's pad, I'm going to do that first. And because this is so big, I'm going to kind of fold it in four. That way I can kind of tuck it and you have less exposed. Now it's tucked in the bedpan. Have Miss Butterworth cross arms, help her turn, instructing her the whole time. We're talking to the patient the whole time. She's grabbing under her shoulders, grabbing under her hip, turning to her side. Now, once she's turned to the side, Grab your bedpan, and we're placing it flush against her backside, rolling her back over on top of the bedpan. Now that she's rolled back over on the bedpan, I'm just going to bring her gown up to make sure she's positioned correctly. And it looks like she's positioned correctly. She has enough under her that'll catch the front and catch the back as well. So now I'm going to cover her up to provide a little bit of privacy. Take her controller, and I'm going to elevate the bed, the head of the bed, because we want her in a good anatomical position. I'll straighten this out in a minute. So that she can urinate, bowel movement, whatever the case may be. But again, she has a catheter, so urination. So now, she's in a good position. Miss Butterworth, are you comfortable? Yes, she's comfortable. I'm going to make sure she has her call light. I'm going to put her bed down to the floor. Discard these gloves. And I'm going to bring this table towards her so that when she's done, lift it up a little bit. So that when she's done, she has tissue to help clean herself. Move these gloves. And wipes if needed, if she prefers that. So, hand washing, hand washing, hand washing. Miss Butterworth, I'm going to give you a little bit of privacy and I'm going to step outside the door. Is that okay, or do you need me to stand behind the curtain? You can step out. So I'm going to step outside the door. No longer than about 5 minutes, and you don't want to walk away in case she needs help. You don't want to be somewhere far off. But stepping outside, giving the patient some privacy, 3 to 5 minutes or so, no longer than 5 minutes, and come back and check on your patient.